So today is an important day in Rhode Island. Today we are here to sign two pieces of legislation that will make prescription drugs more affordable for Rhode Islanders. I want to recognize Speaker Scacchi, Senate President Ruggiero, as far as we're here today, and thank you for your leadership. These things happen because of great leadership in the House and the Senate, and you provide that. So Senators Melissa Murray and Senator Walter Felag, along with Representatives Brian Patrick Kennedy, along with Leonora Felix, for their leadership as well. Thank you so much. I'd also like to recognize the Office of Healthy Aging, our ARP as far as Rhode Island, with Catherine Taylor here. You're a frequent visitor here on some important matters, so thank you for your leadership. And representatives from the American Diabetes Association, thank you for being here today and for all that you do to help Rhode Islanders. And one of the lessons we've learned over the last 18 months of this pandemic is just how important our health is. Our own health, our family's health, our community's health. And shortly we'll be launching a wellness strategy for the entire state of Rhode Island to make sure that people understand that the last year has taken a toll on all of us in many different ways, both physically and mentally, and we need to really step up that opportunity in terms of wellness. I'm looking forward to getting into that next week in terms of really making sure that we're doing everything that we can to keep us healthy in the state of Rhode Island. But managing the illnesses, including diabetes, should not be a cost burden to families. And I'll just share a personal story. I have a friend who passed this year that I was in high school with, played a lot of basketball with, ran on some hard times, and was always calling me to help him out with the cost of his insulin. And we would always respond because we loved John, right? And that happens in all our families and in all our lives. So I was reading an article on the rising cost of insulin in the United States and was interested to learn, according to the article, that Frederick Banting, who discovered insulin in 1923, refused to put his name on the patent because he thought it was unethical for a doctor to profit from a discovery that would save lives. Banting and his co-inventors sold the insulin patent to the University of Toronto for $1. The cost of the four most popular types of insulin has tripled over the past decade, and some estimates suggest that as many as 1 in 4 people with diabetes are now skipping doses, and that was my friend John. In Rhode Island and the United States, this is unacceptable. That's why I'm proud to sign the legislation that will cap the copay amount for the cost for a 30-day supply of insulin. I'm also proud to sign legislation that pharmacists to offer customers more affordable prescription medications, because whether it's making sure that diabetics can afford the insulin they need or helping patients choose the best prescription for their budget, providing affordable medication is the right thing to do. And every Rhode Islander deserves that access to the medications that they need, in many cases, to keep them alive, to keep them healthy. This legislation couldn't come at a more important time. We know that because of COVID-19 pandemic, many Rhode Islanders have deferred routine medical checkups. Routine preventative checkups are important to identify early warning signs of potential longer-term illnesses. I've been talking to the leadership of hospitals over the last several weeks with our Lieutenant Governor, thank you, Lieutenant Governor, about what is really driving some of the pressure that is on our hospitals. So it's not only the fact that there's a staffing issue that needs to be addressed, but there's also a situation where the many patients, many people who are getting admitted to the hospitals over the last year and a half and not really taking care of themselves, or they may have pushed off some of their procedures that now are catching up with us, in addition to some of the mental health issues that are driving that as well. So this legislation could not come at a more important time. that's worth repeating. Over the coming weeks, I'll be working with our team at the Department of Health to promote more wellness strategies for Rhode Islanders, which I believe are so critical now more than ever. And I want to thank, again, the bill sponsors and everyone involved in bringing this legislation forward to make a difference in so many Rhode Islanders' lives. And being here today just highlights that. And I appreciate the fact that we're having these public ceremonies, because it gives an opportunity to not only show the work that's being done in the General Assembly on important matters, but it also gives me an opportunity to address the people in the state about what the driving needs are for us to keep our state healthy.